Hi, I'm Stevie Reyes with Bump Fit Physical Therapy, and today I'm going to show you why it's so important to learn how to retrain the way that we breathe after we have a baby. After we have a baby, it's super important to learn how to breathe the right way, because when we're pregnant and baby's taking up so much space, we end up breathing more through our chest. We end up getting shoulder and neck tightness because we're using all these accessory muscles versus allowing our belly to expand. So let's take a deeper look as to why this is and why it's so important. So before we go ahead and get started, make sure that you hit the subscribe button and give us a thumbs up so that we can continue making these videos for you. So why is it important that we learn how to retrain these breathing muscles? When we breathe the correct way, we want to make sure that we're using our abdominals, our ribs, and our back, that they're all moving and expanding. And the reason we want this is because when we take a deep breath, we want to make sure that there's space for that diaphragm to move down. If we're only breathing up through our chest, we're not going to be able to get that deep breath that we need. The other reason we want to make sure that we're breathing all the way around using our back, belly, and sides is because when we allow the diaphragm to drop down when we take those deep breaths, we're also going to be affecting that pelvic floor. So if this is your diaphragm up here and this is your pelvic floor, when you take that deep breath in, the diaphragm is going to drop down and the pelvic floor is going to do the same thing. So it's going to relax. It's going to allow it to come down. So that's the reason why when someone is having a lot of pelvic floor tightness, we recommend doing these breathing exercises because it's going to allow that pelvic floor to relax instead of always being wound up and tight. So let's get started with our balloon. Let's go ahead and blow this up. All right, so I've gone ahead and written a few things out here. So we got the belly in the front, we got your ribs and your pelvic floor, and in the back, we got your back. So when we breathe, we want to make sure that it's expanding out to the sides. We're expanding downwards. And by expanding, I don't mean that we're forcefully pushing down into our pelvic floor, but rather we are allowing that area to relax and move freely versus staying wound up or versus pushing through it. So there's a little bit of a difference there. And then we also want to make sure that the back is moving. So if we were just to breathe, using our chest muscles, we wouldn't get all that expansion up here. Things would just stay up in that area and nothing would really move below. But we want everything to move. So when I blow up this balloon, it's not just the top that's moving or just the bottom, but the entire balloon is blowing up all the way around 360. And as you'll notice, that the top does get some expansion, but the main expansion is happening around and below. So let's take a closer look at that again. So you'll also notice when I was blowing up this balloon, I was allowing things to let go. And as I'm blowing in, you'll notice that things are contracting. So as I'm exhaling into the balloon, my pelvic floor is lifting up, my ribs are coming down and in, and my abdominals are also coming back and towards my spine. And again, you'll notice that the main breath work is happening into the sides and down, and yes, this is starting to fill up, but it's not the same as down here. So when I have my patients breathe in through their sides, I'm not expecting the chest to be completely still, but I do want the majority of the work happening out and around. So there you have it. I hope that little information helps you understand why pelvic floor physical therapists put a lot of work into the breath work of exercises and why it's so important.